This video is property of Ravzer. Historical development of hydrotherapy, prehistoric and indigenous practices, early human use of water. There is evidence that prehistoric humans recognized the therapeutic potential of water. Hot springs were often considered sacred, and early humans likely used them for both ritualistic and healing purposes. Indigenous cultures. Indigenous peoples around the world, including Native American tribes, Aboriginal Australians, and others, have long used water in healing rituals. These practices often involved bathing in natural springs, using steam baths, and performing cleansing rituals with water. Ancient Greece and Rome. Hippocratic influence. Hippocrates, the father of medicine, is often credited with laying the foundation for hydrotherapy. He believed that water could balance the body's humors and prescribed baths, water drinking, and the application of wet compresses to treat various ailments. Roman baths. The Romans developed an advanced system of public baths, thermae, that were not only centers for bathing but also for socializing and healing. These baths typically included a series of rooms with different temperatures, such as the caldarium, hot bath, tepidarium, warm bath, and frigidarium, cold bath. The Romans also practiced balneotherapy, using mineral-rich waters to treat skin conditions and joint pain. Middle Ages to Renaissance. Decline and preservation. During the Middle Ages, the use of public baths declined in Europe due to concerns about hygiene and the spread of disease. However, hydrotherapy continued to be practiced in Islamic cultures, where scholars like Avicenna expanded upon Greek and Roman medical knowledge. Renaissance revival. The Renaissance period saw a revival of interest in classical knowledge, including hydrotherapy. Physicians like Paracelsus, 1493-1541, advocated for the use of water in treating various diseases. Bathing culture also began to return to Europe, with mineral springs and spas gaining popularity. Development of modern hydrotherapy. Vincent Priesnitz, often considered the father of modern hydrotherapy, Priesnitz developed his methods after observing the natural healing properties of cold water. He established the first water cure establishment in Austria, where patients underwent cold baths, showers, and wraps to stimulate the body's healing processes. His success attracted patients from across Europe and laid the groundwork for future hydrotherapy practices. Sebastian Kneipp, a priest suffering from tuberculosis, reportedly cured himself using Priesnitz's cold water treatments. He later expanded on these methods, incorporating the use of herbs, dietary changes, and physical exercise. Kneipp's approach became known as Kneipp therapy, emphasizing a balanced lifestyle and the therapeutic use of water in different forms, e.g., baths, compresses, and alternating hot and cold treatments. Johann Schroth, 1798-1856. Schroth developed a different approach to hydrotherapy, focusing on the combination of water treatments with dietary restrictions and sweating therapies to treat chronic diseases. Hydrotherapy in the 19th and 20th centuries, sanatoriums and health resorts. The 19th century saw the proliferation of sanatoriums and health resorts across Europe and North America. These institutions offered a range of hydrotherapy treatments, including baths, douches, and steam treatments, often combined with other natural therapies like diet and exercise. John Harvey Kellogg. At the Battle Creek Sanitarium, Kellogg used a combination of hydrotherapy, diet, exercise, and electrotherapy to treat patients. He believed that water could cleanse and rejuvenate the body, and developed a variety of water-based treatments, such as colonic irrigations, sitz baths, and therapeutic showers. Decline and resurgence in the 20th century. Impact of modern medicine. With the advent of antibiotics and advanced medical treatments in the mid-20th century, hydrotherapy declined in mainstream medicine. However, it remained popular in certain holistic and naturopathic circles. Resurgence of interest. In recent decades, there has been renewed interest in hydrotherapy, particularly within the context of wellness and integrative medicine. Modern spas and wellness centers often offer hydrotherapy treatments like hot tubs, steam baths, saunas, and flotation therapy as part of holistic health programs. Foundational principles of hydrotherapy in detail. Thermic principles. Cryotherapy, cold treatments. Cold water treatments are used to reduce inflammation, constrict blood vessels, and slow metabolic processes. Common forms include cold plunges, cold compresses, and ice baths. These treatments are often used to treat acute injuries, reduce fever, and stimulate circulation. Thermotherapy, hot treatments. Hot water treatments help to relax muscles, increase circulation, and relieve pain. Examples include hot baths, steam baths, and saunas. Thermotherapy is often used for chronic conditions like arthritis, muscle spasms, and respiratory issues. Contrast therapy. Alternating between hot and cold water can have a powerful effect on the circulatory system, stimulating blood flow, enhancing lymphatic drainage, and promoting detoxification. This technique is often used in athletic recovery and to treat conditions like varicose veins and chronic pain. Mechanical principles. Buoyancy. Water's buoyant force reduces the impact of gravity on the body, making it easier to move and exercise. This principle is used in aquatic therapy to rehabilitate injuries, improve mobility, and increase strength without putting stress on joints. Hydrostatic pressure. The pressure exerted by water can help improve circulation, reduce swelling, and support venous return. It is particularly beneficial for individuals with circulatory problems or those recovering from surgery. Viscosity. The resistance provided by water's viscosity is used in water-based exercises to strengthen muscles and improve endurance. Chemical principles. Mineral content. The therapeutic properties of certain waters are enhanced by their mineral content. For example, sulfur-rich waters are often used to treat skin conditions, while magnesium-rich waters can relax muscles and improve sleep. Balneotherapy. The use of mineral-rich waters, often from natural springs, is a specific form of hydrotherapy known as balneotherapy. This practice has been used for centuries to treat a variety of conditions, including skin disorders, rheumatic diseases, and respiratory problems. Psychological and emotional benefits. Stress reduction. Hydrotherapy can have profound effects on mental health by reducing stress, anxiety, and depression. Warm baths, flotation therapy, and hydromassage can promote relaxation, improve sleep, and enhance overall well-being. Mind-body connection. The calming effects of water, combined with the sensory experience of hydrotherapy, can enhance mindfulness and the mind-body connection, contributing to mental and emotional healing. Holistic integration. Hydrotherapy is often used in conjunction with other natural therapies such as herbal medicine, nutrition, and physical therapy. This holistic approach aims to treat the whole person, not just the symptoms of disease, promoting overall health and well-being. Preventive care. Hydrotherapy is also seen as a preventive measure, helping to maintain health, boost immunity, and prevent the onset of chronic conditions through regular use of water treatments. Hydrotherapy continues to evolve, integrating traditional practices with modern scientific understanding, and remains an important modality in both conventional and alternative medicine. The physiological effects of hydrotherapy on the body. Hydrotherapy, the use of water in various forms and temperatures for therapeutic purposes, has a wide range of physiological effects on the body. Here's an overview of its impact on the circulatory, muscular, and nervous systems. Circulatory system. 1. Vasodilation and vasoconstriction. Warm water causes blood vessels to dilate, vasodilation, increasing blood flow to the skin and peripheral tissues. This can improve circulation and help with the delivery of oxygen and nutrients to tissues. Cold water leads to vasoconstriction, where blood vessels narrow, reducing blood flow to the surface and conserving heat in the core of the body. This can reduce inflammation and swelling. 2. Enhanced blood flow. Alternating between hot-cold water, as in contrast hydrotherapy, stimulates circulation. The rapid alternation causes the blood vessels to expand and contract, effectively pumping blood through the body, improving overall circulation and reducing blood stasis. 3. Cardiac function. Immersion in warm water can increase heart rate and improve cardiac output as the body attempts to cool itself by increasing blood flow to the skin. Cold immersion can cause an initial rise in blood pressure due to vasoconstriction, followed by a drop in blood pressure as the body acclimates. 4. Capillary exchange. Hydrotherapy can influence the capillary exchange process. Warm water increases capillary permeability, allowing for greater nutrient and waste exchange between blood and tissues. This can aid in healing and detoxification. The contrast between hot and cold applications can stimulate lymphatic drainage, enhancing the removal of metabolic waste and reducing edema. 5. Blood pressure regulation. Prolonged exposure to warm water can lead to vasodilation, which may cause a reduction in overall blood pressure. This is beneficial for individuals with hypertension. Conversely, cold water immersion can initially increase blood pressure due to the body's response to cold stress, followed by a potential decrease as the body adapts. 6. Heart rate variability, HRV. Hydrotherapy can positively impact heart rate variability, an indicator of autonomic nervous system balance. Warm water immersion tends to increase HRV, reflecting a shift toward parasympathetic dominance, relaxation, while cold exposure can temporarily decrease HRV as the body responds to stress. Muscular system. 1. Muscle relaxation. Warm water helps relax muscles by increasing blood flow and decreasing muscle tension. This can alleviate muscle spasms, reduce stiffness, and promote recovery after physical activity. 2. Reduction of muscle pain and spasms. Cold water can reduce muscle pain and spasms by numbing the affected area and reducing inflammation. The cold also slows down nerve transmission, which helps in reducing pain. 3. Improvement in muscle tone and strength. Hydrotherapy exercises, especially in warm water, offer resistance without the impact stress associated with land-based exercises. This can enhance muscle tone, improve joint mobility, and increase strength, especially in rehabilitation settings. 1. Improved muscle recovery. Hydrotherapy can accelerate muscle recovery post-exercise. The increased blood flow from warm water immersion delivers more oxygen and nutrients to muscles, aiding in the repair of microtears and reducing delayed-onset muscle soreness, DOMS. Cold water immersion, often used in sports recovery, can reduce the inflammatory response and muscle damage associated with intense physical activity. 2. Reduction of muscle fatigue. The buoyancy of water reduces the gravitational stress on muscles and joints, allowing for low-impact exercises that minimize muscle fatigue while still providing resistance for strength training. 3. Enhanced flexibility and range of motion. Warm water hydrotherapy can improve flexibility by reducing muscle stiffness and increasing the elasticity of tendons and ligaments. This is particularly beneficial for individuals with arthritis or those recovering from injuries. Nervous system. 1. Stress reduction and relaxation. Warm water immersion has a calming effect on the nervous system. It can stimulate the parasympathetic nervous system, which helps reduce stress, lower anxiety levels, and promote relaxation. 2. Pain relief. Hydrotherapy, especially with cold water, can reduce pain by numbing nerve endings, analgesic effect. This is beneficial for conditions like acute injuries where pain management is crucial. 3. Improvement in sleep patterns. Regular use of warm water hydrotherapy can improve sleep patterns by relaxing the body and reducing stress. It can also increase melatonin production, which is essential for regulating sleep-wake cycles. 4. Stimulation of nerve endings. Cold water therapy can stimulate nerve endings, leading to increased alertness and energy levels. This can be particularly useful for reducing fatigue and boosting mental clarity. 5. Autonomic nervous system, ANS. Regulation. Hydrotherapy plays a crucial role in regulating the autonomic nervous system. Warm water generally promotes parasympathetic activity, leading to relaxation, reduced stress, and improved digestion. Cold water, on the other hand, stimulates the sympathetic nervous system, enhancing alertness, increasing adrenaline, and preparing the body for action. This can be used therapeutically to balance the ANS in individuals with dysautonomia or chronic stress. 6. Neurotransmitter balance. Warm water immersion can increase the production of endorphins, which are natural painkillers and mood elevators. This contributes to the analgesic and mood-enhancing effects of hydrotherapy. The use of cold water can increase the release of norepinephrine, a neurotransmitter that helps improve focus, attention, and mood. 7. Cognitive function and mental clarity. The alternation between warm and cold water can stimulate cognitive function by improving circulation to the brain and promoting the release of neurotransmitters associated with alertness and mental clarity. Hydrotherapy, by affecting these systems, can help balance the body's internal environment, promote detoxification through sweating, and support overall homeostasis. Regular hydrotherapy treatments can lead to improved immune function, better digestion, and enhanced overall well-being. Cold hydrotherapy. Temperature range, typically below 70 degrees Fahrenheit 21 degrees C. Applications: cold baths, cold compresses, cold showers, ice packs, cryotherapy. Physiological responses: vasoconstriction. Cold temperatures cause blood vessels to constrict, reducing blood flow to the area. This can help decrease inflammation, swelling, and pain, making cold hydrotherapy particularly useful in the acute phase of injuries. Metabolic rate reduction. Cold exposure slows down cellular metabolism, reducing oxygen and nutrient demands and conserving energy. Nervous system stimulation. Cold applications stimulate the sympathetic nervous system, leading to increased alertness and a heightened state of arousal. Immune system boost. Brief, cold exposure can enhance the immune response as it stimulates the production of white blood cells and improves circulation. Pain relief. Cold can numb nerve endings and decrease the sensation of pain through the gate control theory of pain. Warm-hot hydrotherapy. Temperature range, generally between 95 degrees Fahrenheit 35 degrees Celsius and 104 degrees Fahrenheit 40 degrees Celsius. Applications: warm baths, hot compresses, saunas, steam rooms, hot tubs. Physiological responses: vasodilation. Warm temperatures cause blood vessels to dilate, increasing blood flow to the area. This helps to relax muscles, reduce stiffness, and promote healing in soft tissues. Metabolic rate increase. Heat speeds up cellular metabolism, which can enhance the healing process by delivering more oxygen and nutrients to tissues. Nervous system relaxation. Heat has a calming effect on the nervous system, reducing stress and promoting relaxation. Detoxification. Through sweating, heat encourages the elimination of toxins from the body. Pain relief. Heat soothes discomfort by improving blood flow and relaxing tense muscles, making it beneficial for chronic pain conditions like arthritis. Contrast hydrotherapy. Technique: alternating between hot and cold applications. Applications: contrast baths, alternating hot-cold compresses. Physiological responses: vascular pumping. The alternation between vasoconstriction, cold, and vasodilation, warm, creates a pumping action in the blood vessels, which enhances circulation and aids in the removal of metabolic waste. Stimulation of circulation. This technique can be particularly effective for improving circulation in areas with poor blood flow, promoting healing and reducing edema. Muscle relaxation and pain relief. The contrast between temperatures can help to relax muscles and provide pain relief by reducing inflammation and enhancing tissue oxygenation. Immersion hydrotherapy. Technique: full or partial body immersion in water, which can be warm, cold, or neutral. Applications: therapeutic baths, whirlpools, aquatic therapy. Physiological responses: buoyancy. The buoyancy of water reduces the gravitational load on the body, which can relieve pressure on joints and muscles, making it easier to move and exercise, especially for individuals with arthritis or mobility issues. Hydrostatic pressure. The pressure exerted by water on the body can improve circulation and decrease edema, particularly in the lower extremities. Thermal conductivity. Water conducts temperature more effectively than air, which can intensify the thermal effects of cold or warm applications, enhancing their therapeutic benefits. Muscle and joint support. Immersion therapy can reduce muscle spasms, improve range of motion, and increase overall physical function. Steam and sauna therapy. Technique: exposure to high heat and humidity. Applications: steam baths, saunas. Physiological responses: profuse sweating induces sweating, which can help with detoxification and skin cleansing. Cardiovascular benefits. Regular sauna use has been shown to improve cardiovascular health by enhancing circulation and reducing blood pressure. Respiratory system effects. Steam inhalation can help clear airways, alleviate congestion, and improve respiratory function. Mental relaxation. The warmth and humidity promote relaxation and stress reduction. Neutral temperature hydrotherapy. Temperature range between 92 degrees 33 degrees C and 98 degrees 37 degrees C, close to skin temperature. Applications: neutral baths, watsu, water massage therapy. Physiological responses: soothing and calming, neutral temperature, Water is particularly soothing and can be used to calm the nervous system, reduce anxiety, and promote overall relaxation. Gentle circulatory effects. There's minimal impact on circulation, making it suitable for individuals who may not tolerate extremes of temperature well. Homeostasis. Support. Neutral water temperatures can support the body's natural balance and are often used in therapies focused on relaxation and stress reduction. Localized hydrotherapy. Technique. Applying water or steam to a specific body part. Applications: sitz baths, foot baths, hand baths. Physiological responses. Targeted relief. Localized hydrotherapy can be used to relieve symptoms in specific areas, such as hemorrhoids, sitz bath, headaches, cold compress on the forehead, or arthritis in the hands, feet. Localized circulation improvement. Enhances blood flow to the treated area, aiding in the healing of localized injuries or conditions. Therapeutic considerations. Duration. Shorter exposure. Times are generally used for more intense temperature differences, while longer sessions may be used for neutral or mild temperatures. Individual variation. Responses can vary widely based on age, health status, and individual tolerance to temperature changes. Contraindications. Certain conditions, such as cardiovascular disease, respiratory disorders, or Raynaud's disease, may require modified or avoided hydrotherapy techniques. Understanding the body's response to these different types of hydrotherapy allows practitioners to select the most appropriate method for their clients, aiming to maximize therapeutic benefits while minimizing risks. Hydrotherapy is the use of water in various forms, liquid, steam, or ice, to treat a wide range of health conditions. Different hydrotherapy techniques apply water at different temperatures, pressures, and durations to achieve specific therapeutic effects. Here's a breakdown of some common hydrotherapy techniques. Hot compresses. A cloth soaked in hot water is applied to specific body areas. Temperature typically around 104 to 113 degrees Fahrenheit, 40-45 degrees Celsius. Duration 15 to 20 minutes. Benefits. Promotes circulation, relaxes muscles, relieves pain, and soothes chronic injuries or tension. It's often used to alleviate muscle spasms, menstrual cramps, and joint stiffness. Cold compresses. A cloth soaked in cold water or an ice pack is applied to specific body areas. Cold compresses are usually around 50 to 59 degrees Fahrenheit, 10-15 degrees Celsius. Duration 10 to 15 minutes. Benefits. Reduces inflammation, numbs pain, and decreases swelling. Commonly used for acute injuries, headaches, and fever reduction. Contrast baths involve alternating between hot and cold water immersion. Typically one immerses a body part in hot water for about 3 to 4 minutes, then in cold water for 1 to 2 minutes, repeating the cycle several times. Benefits include improved circulation, reduced muscle soreness, and accelerated recovery from injuries. Whirlpools are baths where water is agitated by jets to create a massaging effect. Temperatures can be warm or cold depending on the therapeutic goal. They provide gentle massage, relax muscles, reduce joint stiffness, and can improve flexibility. Saunas are dry heat exposures in wood-lined rooms. Often at high temperatures with low humidity, they induce sweating, detoxify, relax muscles, improve cardiovascular health, and relieve stress. Steam baths expose users to moist heat with high humidity. Opening pores, promoting sweating, aiding respiratory function, and relaxing muscles. Key differences: hot treatments, compresses, saunas, steam, promote relaxation and circulation, while cold treatments reduce inflammation. Saunas are dry, steam rooms are humid. Whirlpools and contrast baths involve immersion with or without agitation. Compresses are localized, whereas saunas, steam, and whirlpools affect the whole body. Therapeutic goals depend on whether the aim is relaxation, inflammation, reduction, circulation improvement, or other specific benefits. Specific health conditions and ailments that can be effectively treated with hydrotherapy. Hydrotherapy is a versatile treatment modality that uses water in various forms, hot, cold, steam, or ice, to treat a range of health conditions and ailments. Here are some specific health conditions and ailments that can be effectively treated with hydrotherapy. 1. Musculoskeletal conditions. Arthritis. Hydrotherapy can reduce joint pain and stiffness, improve mobility, and increase muscle strength in individuals with arthritis. Back pain. Warm water therapy can alleviate chronic back pain, improve flexibility, and promote relaxation of tense muscles. Fibromyalgia. Warm water hydrotherapy can help reduce pain, stiffness, and fatigue associated with fibromyalgia, muscle strains and sprains. Cold water immersion can reduce swelling and inflammation, while warm water can promote relaxation and healing. 2. Cardiovascular and circulatory conditions. Hypertension. Alternating hot and cold water therapy can improve circulation and help regulate blood pressure. Varicose veins. Cold water hydrotherapy can reduce swelling and improve venous return. Poor circulation. Hydrotherapy can stimulate blood flow and enhance circulation in individuals with circulatory issues. 3. Respiratory conditions. Asthma. Steam inhalation can help relieve bronchial congestion and improve breathing in asthmatic patients. Bronchitis. Warm steam inhalation can loosen mucus, ease coughing, and soothe irritated airways. 4. Digestive disorders. Irritable bowel syndrome, IBS. Warm water baths and abdominal compresses can relieve abdominal pain and improve digestion. Constipation. Warm water hydrotherapy can help stimulate bowel movements and relieve constipation. 1. Nervous system conditions. Stress and anxiety. Warm water immersion and baths can promote relaxation, reduce stress, and improve sleep quality. Insomnia. Hydrotherapy treatments, such as warm baths or foot soaks, can help induce relaxation and improve sleep patterns. Headaches and migraines. Cold compresses or alternating hot and cold water applications can relieve tension, headaches, and migraines. 2. Skin conditions. Eczema and psoriasis. Warm baths with added herbal extracts or essential oils can soothe irritated skin and reduce inflammation. Acne. Steam treatments can help cleanse the pores, reduce oil buildup, and promote clearer skin. 3. Rehabilitation and recovery. Post-surgery recovery. Hydrotherapy can aid in the recovery process by reducing pain, promoting circulation, and enhancing mobility. Sports injuries. Hydrotherapy, especially contrast baths, can reduce inflammation, speed up recovery, and relieve pain in athletes. 4. Chronic pain conditions. Chronic fatigue syndrome. Hydrotherapy can improve energy levels, reduce pain, and promote overall well-being. Rheumatoid arthritis. Warm water therapy can reduce joint pain, inflammation, and improve mobility in patients with rheumatoid arthritis. 5. Metabolic and endocrine conditions. Diabetes. Hydrotherapy can improve circulation and reduce the risk of complications such as neuropathy. Obesity. Hydrotherapy can support weight management by improving metabolism and enhancing physical activity through water exercises. 6. Gynecological and obstetric conditions. Menstrual pain. Warm baths or sitz baths can relieve menstrual cramps and promote relaxation. Pregnancy. Freuderkrau, ein Freileisen sind pregnancy-related discomfort. Hydrotherapy can alleviate back pain, swelling, and muscle tension during pregnancy. The role of hydrotherapy within a broader naturopathic treatment plan. Hydrotherapy plays a significant role within a broader naturopathic treatment plan, offering a versatile and non-invasive approach to support the body's natural healing processes. Here's how hydrotherapy integrates into a naturopathic treatment plan. 1. Foundational principles. Enhancing circulation. Hydrotherapy techniques, such as contrast baths and hot and cold compresses, stimulate blood flow, aiding in the delivery of nutrients and oxygen to tissues while promoting the removal of waste products. Detoxification. Through sweating and increased circulation, hydrotherapy assists in the body's detoxification processes, helping to eliminate toxins. Stress reduction. Water treatments like warm baths, whirlpools, and steam baths can significantly reduce stress and promote relaxation, which is essential for overall health and healing. 2. Complementary therapies. Combination with herbal medicine. Hydrotherapy can enhance the effects of herbal treatments. For example, herbal baths or compresses can deliver the therapeutic properties of herbs directly to the skin, while internal herbal treatments can be supported by the improved circulation and detoxification from hydrotherapy. Support for acupuncture and manual therapies. Hydrotherapy can be used before or after acupuncture or manual therapies like massage to relax muscles, making these treatments more effective and comfortable for the patient. Integration with nutrition. Hydrotherapy supports digestive health, which can be synergistically enhanced by a tailored nutritional plan. Techniques such as cold abdominal compresses can stimulate digestion and improve metabolic function. 3. Tailored treatment approaches. Chronic conditions. In managing chronic conditions like arthritis, fibromyalgia, or cardiovascular diseases, hydrotherapy is used to alleviate pain, reduce inflammation, and improve joint mobility. Acute conditions. For acute injuries, such as sprains or strains, cold water treatments can reduce swelling and pain, while warm treatments can be introduced later to promote healing and flexibility. Immune system support. Regular hydrotherapy treatments can boost the immune system by stimulating the production of white blood cells and enhancing lymphatic circulation. 4. Patient education and empowerment. At-home treatments. Patients can be educated on simple, at-home hydrotherapy techniques, like foot baths or cold showers, empowering them to take an active role in their healing process. Lifestyle integration. Hydrotherapy is encouraged as part of a broader lifestyle approach, including regular exercise, proper hydration, and stress management techniques. 5. Safety and contraindications. Personalization. Hydrotherapy must be tailored to the individual's health status, ensuring that treatments are safe and appropriate. For example, patients with certain cardiovascular conditions or temperature sensitivities may require modifications. Monitoring. Continuous monitoring and adjustments ensure that the hydrotherapy treatments align with the patient's overall progress and evolving health needs. Hydrotherapy is a foundational component in naturopathic medicine, supporting and enhancing other treatment modalities through its multifaceted effects on the body and mind. By integrating hydrotherapy into a broader treatment plan, naturopathic practitioners can provide a holistic approach that promotes overall wellness and empowers patients in their healing journey. Integrate hydrotherapy with other naturopathic modalities for comprehensive care. Integrating hydrotherapy with other naturopathic modalities can provide a holistic and synergistic approach to care. Here's how you might combine hydrotherapy with herbal medicine, nutrition, and physical therapy for a comprehensive treatment plan. 1. Hydrotherapy and herbal medicine complementary use. Warm compresses with herbal infusions. Use herbal infusions, like chamomile or ginger, for warm compresses to soothe sore muscles or joints. The herbs can enhance relaxation and reduce inflammation. Herbal baths. Add herbs such as lavender or Epsom salts to bath water. This can provide both physical relaxation and therapeutic effects from